So last time we talked about why delaying care is so costly and how small preventative steps can completely change your health story. And today I want to share three easily avoidable mistakes that I see far too often, mistakes that quietly lead to long-term complications. And these aren't too rare or dramatic. They're things many people do without even realizing the impact. But each one teaches us how powerful simple awareness can be. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician with special training in menopause care and founder of InTouch Primary Care, where we help people stop waiting for a crisis and start building real health through personalized proactive care. Okay, so mistake number one, taking certain over-the-counter sleep medications long-term. So I recently spoke with a patient who told me they had been taking Advil PM every night for a few years. So now Advil PM sounds harmless. It's over the counter, right? It's actually a combination of ibuprofen and NSAID pain reliever and diphenhydramine, which is an antihistamine that can make you sleepy. The problem, which they didn't really realize, is they didn't even need the ibuprofen part at all. They just wanted to sleep. And taking an NSAID daily for years, was like 2 years or more, can disrupt your gut. It can increase your risk for ulcer, for bleeding, and inflammation in the intestines, what sometimes is called leaky gut. So when your gut is inflamed, it can also affect your mood, can affect your focus and your energy because the gut and the brain are deeply connected. And then diphenhydramine, which is the PM part of the Advil, carries its own issues too. It can cause dry mouth, it can cause constipation, memory problems, and morning after grogginess that can be even worse than alcohol on driving tests. So with long-term use, it's linked to cognitive decline and dementia risk in older adults. So this is what makes the story actually stand out. They didn't even know, they didn't realize that it was an issue. It only came up because we took the time to talk through their daily habits. They thought they were helping themselves sleep, but in reality, they were creating other problems, digestive discomfort, mood changes, brain fog. So by trying to self-treat one issue, they unknowingly created and worsened others. And many people self-treat because they don't have easy access to their doctor or their visits are too rushed to discuss the small details that really, really are not small, that really matter. And that's why whole person care is so important. So if you live in Texas and you want a doctor who actually takes time to understand what's going on, not just the symptom, but the reason behind it, schedule a free 15-minute consultation with me. Let's review your daily habits and make sure the things you're doing for relief aren't quietly working against you. So the next mistake, and you can schedule with the link in the description. So the next mistake is delaying treatment of chronic conditions. And this is something I talk about often because this is something I continue to see often. I saw a patient recently who told me that he'd known his blood pressure had been high for a few years. So he was given medication before, he took it for a little while, didn't like the way it made him feel, and he stopped it. And then he just didn't follow up. So now a few years later, he's back, but this time, now he has chronic kidney disease. Because of that, it's harder to control his pressure. He now needs two medications, and we have to do additional heart and kidney testing. So this is not an older person. This is somebody in his 30s. So he thought he was too young for serious problems, so he just ignored them. The problem is when we wait to address chronic conditions, they don't disappear. They quietly get worse. They become harder to treat. They become more expensive to treat. So untreated, poorly controlled high blood pressure is actually one of the leading causes of kidney disease, heart disease, and strokes. And in today's world, we really don't have to delay care because of insurance. Many primary care practices, including ours, offer affordable cash pay visits or membership options where you can see the same doctor consistently. So urgent care is great for quick fixes, but it's not the place for continuity of or prevention of continuity of care or health prevention. You need someone who knows your story, your labs, your health goals. So if you've been told you have a chronic condition like high blood pressure, diabetes, prediabetes, high cholesterol, and you've been putting it off, don't wait. You can, if you live in the Texas area, schedule a free 15-minute consultation. Let's see if you're a good fit for a practice before it becomes complicated. So, if you're finding this helpful, please take a moment to like, to share, to subscribe to our YouTube channel, because it really does help more people discover practical ways to protect their health and stay informed. So if you haven't already, please like, share, and subscribe. Thank you in advance. So the third mistake I want to share is this juicing or quote unquote healthy smoothies that spike blood sugar. So I remember a patient years ago when I worked in a traditional practice. He had early diabetes, and I told him, eat healthy and exercise. I didn't have time to go into a lot of detail. I was rushing in between patients. Well, he came back 3 months later and his A1C had jumped from like 6 point something to 11 point something. And I was shocked because he seemed very agreeable to the things, I thought he was going to do something, right? Well, I asked him what he'd been eating, and he proudly said, Doc, I've been eating healthy. I've been juicing every day. I've been, doing smoothies, mango, orange, banana, pineapple smoothies. And he meant well, but in trying to quote unquote eat healthy, he was drinking the sugar from 5 fruits or several fruits in few minutes. So yes, fruit is healthy, but how you eat it matters. When you juice or blend large amounts of sweet fruit, you strip away the fiber that slows down the sugar absorption, so your blood sugar spikes rapidly, then crashes. And over time, that worsens insulin resistance. So this happens all the time. Even people who don't have diabetes can push their sugar and insulin levels higher without realizing it. And that's why it's so important to have open conversations about what is healthy and and how and actually what healthy actually means for your body. Food is medicine, but the wrong dose can cause problems. So if you're trying to make healthy changes, especially if you're not sure if what you're doing is helping or hurting, if you live in the Texas area, let's talk. Schedule a free 15-minute consultation. Let's make sure that your efforts are truly moving you forward towards better health. So imagine knowing exactly what helps your body, that you're not having to guess, you're not having to self-treat, you're not having to Google, but you truly understand it. Imagine getting answers before problems arise. Imagine having a doctor who connects the dots between your habits, your labs, and your future health. These three mistakes, long-term over-the-counter use, delayed follow-up, misunderstood nutrition, are really all avoidable with the right time, awareness, and connection. And that's what personalized whole person care makes possible. So I'm Dr. Lola Ashaye. Thank you for joining me on Connecting the Dots. If you're in Texas and you're ready for a better approach to your health, one that is proactive, preventative, and truly personalized, schedule your free 15-minute consultation today. Let's make sure you're not managing illnesses, but building lifelong wellness.